My task is to set the political scene for these deliberations and trying to figure out where we may be going. And I need to open with a couple of prefacetory remarks. One is the deer in the headlights phenomenon is people tend to take what's being said in Washington as action. So far, nothing has actually happened. So you can sweat a little less for a moment. Eventually there will be action, and that's what we want to deal with, but it just hasn't quite happened yet. The other, as a political scientist, our task is to try to understand what's happening today and what may happen tomorrow, which is naturally predicated on what's happened in the past. It's the past experience that gives us the insights and the data to allow us to model the future. I have been saying over and over again over the last several days that this is rather like having experienced life entirely on Earth, and then in the Trumpian world, having to use that experience to explain what it's going to be like on Mars. It's a hard task, so bear with us. What I'm going to try to do fairly quickly, it'll be fairly rapid, is to give you a sense of the political terrain and what that might be translating as. Jack at one point said to me, a kind of a core question was, are they really crazy enough to repeal the ACA and have all the consequences of tens of millions of people without insurance, even with whatever the replacement may be? So let me give you one answer. Let's pretend for the moment that we have only a House of Representatives. What does that House of Representatives look like? To put it in historical context, here are 9 first-term presidents of the United States, and on the left so far right now, you see the number of House seats that their party has had. And one thing you see at the bottom is that the Republican Party with President Trump is not at the high end of that number of seats. Other presidents have had many more seats to work with, including President Obama. But it's important to know whether or not they stick together. And one thing that we know is in the past, the two parties were quite diverse. That has changed dramatically over the last couple of decades. And so if you ask, how often do they vote together, and then how can that translate within each party into a kind of base party vote, what I call solid votes in the House? What you see is, in fact, it's in the last several presidencies where their political parties have created a substantial base, in many cases over a majority of 218, that allows them to act. And in the case of the Republicans and Donald Trump, it looks like based on the experience in Congress over the last few years and the unity among Republicans, that they have enough to have a working majority, even with some defections. And on the Affordable Care Act, they're particularly unified because this has become such a central issue for them. Now, another issue is what direction are these parties going to go? Would the Republican Party go under Donald Trump? These are data that are too complex to explain in full, but they are measures of ideology that have been done using the votes by Keith Poole and Howard Rosenthal, using the votes, all roll call votes in the House of Representatives from 1789 to present, to create an index that goes from -1 most liberal to +1 most conservative, and being able to place each member on that vote. And that factor that's being captured is basically about government intervention. Is it good? Should we do it? Is it bad? Should we not do it? On issue by issue basis. And what you see here is from 1879 to 2015, the Republican Party has gone up and down in its conservatism, but for the last many years has been on a path deeply to the right, much more conservative than any time in the post-Civil War history of the Republican Party, while the Democrats have meandered more or less in the same place. So this is a very conservative party. Now, put it even more strongly, if you take look at the center, the kind of -5 to 0.5 to +0.5 on this -1 to +1 scale, and look who's in the extremes, 80% of the Republicans in the House are in the extreme of their party, the right wing of their party, including Speaker Paul Ryan, who scores around a 0.85, very near. So are they crazy enough? Yes. And I don't mean to say that being conservative is crazy. What I mean to say is they are taking on a very bold, incredibly dramatic change, and very likely to do it if it were just a House We would certainly see Medicaid be block granted or put into a per capita cap. We would certainly see Title I of ACA go away, which provides for the market exchanges and the subsidies. We would certainly see a change, fundamental change in the approach of the federal government, which would lead probably to tens of millions of people to losing their insurance and tens of millions more having much less effective and comprehensive insurance. We'd be in a situation, to quote the conservative Grover Norquist, we just need a Republican president with enough working digits to handle a pen. And I think Donald Trump, seeing his signature, is able to do that. Okay. But let's take on another scenario, which is closer to reality. After all, we don't have just a House, we have a Senate. We have a bicameral legislature, and we have separation of powers. The president, who is not part of the legislature, unlike many countries, has to orchestrate change with the legislature. And so let me bring in now what we call normal political capital. What it is that presidential scholars look at when we're trying to ascertain what explains whether or not presidents are able to be influential in the Congress as a whole. We start with the election process. Now, you've all heard President Trump say that he's had a historic election, a landslide in the Electoral College, and but for 3 to 5 million illegal voters would have captured the popular vote. Here's where he really ranks. This is the Electoral College. Out of all 58 elections in American history, his was 46th in the size of his majority, or 25th out of 29 since 1924. On the popular vote side, the one that we count, he is 47th out of 49, or 29th out of 29 since 1924. Now, presidents who've been effective, where have they been? Well, let's look at FDR, LBJ, and Ronald Reagan. They had substantial support in the electoral process. Other presidents who were pretty effective in doing some big things, Bill Clinton and Barack Obama, also did pretty well in both of these measures of the electoral process. Presidents who struggled with their legislative agendas are more in the range where Donald Trump is. In fact, of course, on the popular vote side, considerably higher. And just if you're curious, if Hillary Clinton had won, she'd also be struggling. Because it would be a very difficult environment to work in, but she'd be on the order of a Jimmy Carter. Okay, that's that. And as Ronald Brownstein has written, Trump is preparing for policy change at home and abroad that would be appropriate after a landslide victory he did not achieve. Now, what about popular support? Gallup and other organizations are constantly asking people, do you approve of the job performance of the president? And what we see here, Gallup's only done this for 4 presidents, unfortunately, asking of that job approval during the course of the transition. One thing that stands out is that Donald Trump would scored a little lower than previous presidents, 40 points lower than Barack Obama in his first transition. And then if we look at popular support in January...
That was Mr. Trump.
There we go. All right. As you can see, in the first reads in popular approval of a president coming into office tend to be pretty healthy, much higher than Donald Trump going in. And by the way, in the last couple of days, Gallup has done its first poll and finds Donald Trump at 45% coming into office. And the other thing to note is, we know from the data, these numbers go down. They don't typically go up right at the beginning. So this is not the place you'd want to be if a president, to be a president having influence. Let's do the same thing as seats in the Senate. Lots of seats. Trump's party not very high, but when you do the control for party unity, still not all that high. He has a 52-seat majority in the House and Senate, but they don't always hold together. And trying to hold that together would really require, in order to have a majority, Obama did much better than Trump. Trump would have to have 96% of the Republicans hanging together all the time. And I'm running out of time, so I will quickly move on. Ideology. As the parties have separated ideologically in both the House and the Senate, this is just the Senate, fewer bills get passed because of stalemate. There have been 3 modern Republican presidents who've come into office with Republican Senates. What does it look like? Well, we start with Reagan, and then Eisenhower, Reagan, Bush. In other words, Trump has come into office at a time in which there's increasing difficulty in getting anything through Congress because of the stalemate created by the ideological divisions. I'm going to skip through that just to let you know that president's parties lose seats in the House routinely in the next midterm election, and that's particularly true for presidents who try to do big things, like Johnson, Reagan, Clinton, and Obama. So the prospect of them losing seats coming is very significant. Just in terms of public support as well on health care issues, it turns out suddenly the Affordable Care Act is becoming more attractive to people. This is the Kaiser numbers. They're pretty close. This is not the kind of grand scale that you normally push on. What do people want to have happen with the Affordable Care Act? Well, and this from the Pew research, 54% want to either keep it as is or expand it, compared to 39% who want to repeal it. On the Kaiser side, 47% want to keep it, 49% say to repeal it, but most of them say not until you have an alternative. You have to have an alternative before you try to repeal it. All this is to suggest something I've called the fear arc. You come in with an idea, you can promote that idea effectively. Typically, public opinion will go up, but as the opposition works away at it, you get this decline. That's what happened to Truman and Clinton with their health care reform plans. Obama managed to capture the moment of enactment before his plan went below the 50% margin. I'm guessing Trump is somewhere around here. So I'm trying to leave you with an optimistic sense, if you like the Affordable Care Act, and a pessimistic one if you don't like it, that it's going to be very hard to change this. And my guess is we're going to have a Medicaid program, but with more flexibility. We're going to have something like the ACA, but with more flexibility. But it's not going to go away entirely, and tens of millions of people are not going to lose their insurance. I hope I'm right. Thank you.